Welcome to Business Connection. I'm Liz Spencer. We have a wonderful guest in studio. It's Adam Russo. He's the chairman and CEO of Edgewood Clinical Services. Adam, welcome back.
Hi, thank you.
Good to see you.
Yeah, same here.
Tell me a little bit about Edgewood Clinical Services.
Edgewood is a full-service outpatient mental health practice. So we do the full gamut of care for outpatient services with behavioral health. We employ about 60 total staff, about 40 of which are social workers, counselors, psychologists, and then psychiatrists for medication management.
Wow, that's big. Now, tell me a little bit. There's a lot of other clinics like yours in the area. What differentiates yours? When
we were small, and just a couple of clinicians kind of making this work, we really operate off of three main principles, and we've stuck with those principles as we've gone forward, which is how do we provide the highest quality of care, how do we provide the greatest access to care, and how do we mainstream mental health services. There are many agencies locally, and I do believe many of them are high quality agencies. One of a large differentiating factor for us is access to care. As you know, with health insurance and all of the things that have been going on with costs and deductibles, insurance networks, all these things, we have done everything we can to stay in as many networks and to be as accessible to our clients as possible. So whoever wants to receive the care, we don't want finances or insurance to be a barrier to treatment. And then mainstreaming mental health, we make it a very strong point to be active in the community, whether it's in schools or otherwise, to make sure that we're in front of as many people as possible, educating as many people as possible about mental health, the things that go on in life, culture, et cetera, that really make it so that they can feel comfortable with taking care of their own mental health, whether it's themselves or their families.
Adam, it's important to have a good match with that clinician.
Yes.
How do you help that? How do you foster that? What do you tell people to look for?
Well, our intake department handles all the calls coming in, and so the intake department does all the interviews with our existing clinicians. So they understand clinician specialties and as far as what they're comfortable working with and experience working with, and then at the same time also get an understanding of their personalities. We have some clinicians who are very energetic, and some are very laid back. Some are more structured. Some are more free flowing. And so depending on when people call in and who it's for and what they're looking for, intake does a great job at trying to make that match accurately the first time round. But sometimes it doesn't always work that way, and so we're very comfortable with making a switch. Should a client say that great effort, but that didn't go well, and clinicians don't take it personally. Everyone knows that they're not a great fit for everybody, but we do our best to have a match that's productive for the client to address what their needs are.
Tell me about what some of your most utilized services are.
So individual counseling definitely is one, and that's everything from people who, adults and kids with depression, anxiety, people struggling with divorce, to more serious issues of trauma and substance use and those kind of issues. But individual therapy really makes up the bulk of what we do. And then marriage counseling probably comes in second. Vast number of couples who come in for counseling, and it's not necessarily because of the kind of stereotypical substance use or infidelity. I mean, that's certainly a part of it. But there's life changes. There's job issues. There's life stress. There's medical issues in families. There's all these things that generate real struggles in relationships, and people come in and address those things. And then lastly is psychological testing. We do many diagnostic assessments that our psychologists specifically do. Many of them are for kids. Most often it's, if parents have a question of, does my child have ADD? Well, psychological testing is a great way to get a differentiating diagnosis of, is it ADD or is there a learning issue? Many kids who have learning disorders exhibit the same symptoms as ADD. So if it's a learning issue, why would you put a kid on medication for ADD when that's not even it? So it enables to get a clear diagnostic path to then dictate what treatment should look like.
That's wonderful. Well, I think lots of people probably would benefit from seeing an individual therapist, because our friends are not always our best answer. Yeah, friends are good at kind of being supportive, and while that's great in one respect, sometimes people need to look in the mirror on the other, and sometimes it's hard to look in a mirror, and a good clinician will be able to ask those difficult questions in a way that's empathic and supportive, but at the same time challenging. Right, and you don't have to worry about being your therapist's friend.
Exactly,
and
yes.
That's a big one. Now, you do a lot of outreach in the community. Why do you do that, and what are you doing?
Well, again, it's part of the mainstreaming piece. We do believe that in order for mental health and people to really be able to take care of their overall well-beings. It's not just the financial, and of course that's important, and spiritual is important, and vocational is important, and educational, it's important. But there's the mental health component, and mental health for a long time hasn't been normalized. And so we really want to just make it normal, that it's okay for people to feel, to normalize anxiety. There are many things in life that people should feel anxious about. Culturally, we try to teach our kids not to feel anxious. We try to make it and teach that everything needs to be okay all the time. But that's not life. All adults know it's not life, but we don't talk to our kids about that. So we want to be in front of people normalizing things that are hard, that should be hard, and educating about various factors and warning signs and flags that parents should be aware of for their kids or themselves, depending on the topic.
Right. Now, you've partnered with some community partners to do something really neat for us. Tell me about that. Yeah.
So one of the things, I work with the local school districts quite a bit over the years, and we talk a lot about how parents don't like to access care. They don't like asking questions to the school social workers because they're afraid of what's going to happen, what's going to get communicated within the schools. They don't want to go to the pediatrician. And it's not really, they don't believe it's serious enough to make an appointment with a counseling agency because they don't want to go down those roads. And so for a long time, I've been thinking about, well, how do we just create opportunities for consulting for families? And in talking with Kids Matter in the Naperville Park District, we were able to start setting up a partnership with multiple agencies, both for-profit and not-for-profit, so we're able to staff a licensed clinician at the Fort Hill site for the Naperville Park District and the 95th Street Y every Wednesday morning from 9 to 11. So there's a clinician on site who will accept walk-ins, and just the whole idea is just for parents or adults to just ask questions about mental health. Is it okay that my child is 8 and they still want to climb into bed with me at night to sleep? My kid is struggling in school. What should I do to address this? And so a clinician can just give some guidance. Sometimes it might be, this is a real problem. Here's some referrals for you to get help. Sometimes it might be, this is totally normal. Don't worry about it. And sometimes it might be, might be a problem, but here, watch out for these signs. And then if you start seeing X, Y, or Z, then maybe it's time to make a call for a referral. So just to give parents kind of that barometer and touch point to get some mental health and behavioral questions asked where it's hard for them to find those resources.
Well, I also think that you give them 15 minutes with a professional, and I think they get a lot of experience that they didn't judge me. It wasn't as scary as I thought. Oh my gosh, I learned so much in those 15 minutes. Yeah. So I think it's a real eye-opener and access to maybe I can do this, and I can go seek some support when I need it.
And the important part too is, as far as that consulting goes, there's no cost to people coming in. It's just volunteered time from the staff of the agencies. And what most people don't maybe isn't necessarily common knowledge is that as a clinician, for better or worse, we've heard a lot of stories over years. And what people think might not be very normal, or they might sound embarrassed of, they might be surprised at what clinicians have actually heard and experienced, and how maybe in the spectrum of that, things are more normal maybe than they think it is.
It is. Well, Adam, thank you for all that you do for the community and helping us with our own mental awareness and taking care of ourselves. So thank you. We wish you continued success.
Thank you.
We'll be right back with more Business Connections. Stay tuned.